So let's look at a few other things about his positioning. If I want to work on scapular anterior elevation, okay, we already looked at that in standing. Here's my anterior elevation. We're going to train all of these patterns when we isolate them in sideline, okay, and then we'll talk in a couple of weeks about how we translate that to different positions, but we're going to start in sideline. So if I'm going to work in anterior elevation with him, I'm going to set him up so that I can get my body in the best possible position. All right, so right here, if I want to be able to resist him in this direction, in anterior elevation, and I said that my shoulders and hips and forearms have to be in that position, I can't really do it from here, because if I try to resist him here, I'm going to go into a much wider diagonal than what we talked about. Again, we said it's just slightly off midline. So what I'm going to have Eli do is keep your shoulders right where they are and just scoot your hips back towards me. Keep coming. Okay, so now, if I get him here, and I position my body so that my hips and shoulders are facing the direction I want to go, if I just passively move him, now we're going up towards that anterior elevation position. Okay, so when I'm working in this diagonal pattern, I want his shoulders slightly away from me, his hips slightly towards me. Okay, so if you think about making a triangle with the table, the point is facing me. Okay, it's getting bigger out here, so I can stand and be right in that anterior elevation pattern. Okay, I'm going to bring the table down just a little bit. Alright, so the first thing that I want to do is I want to set his scapula. If he's starting here, which is where he was when he got on the table, and you can see where that scapula is sitting in that protracted, abducted, tipped position, there's no way I want to start training efficient functioning of him moving his scapula in that direction when he's that tipped. So I need to be able to set his scapula. The way that I'm going to do it first is I need to make sure that I've got his humerus positioned in the direction that I want him to go. So if I want to go up towards anterior elevation, which is just slightly forward to his ear, okay, between his ear and his eye right here, I want to put his humerus in that position, so in that diagonal. So right here, just bringing him back already gets him in a better position. Okay, so now if I look, everything pointing in this direction, we're going right up towards that anterior elevation pattern. Okay? Now, when I go to set his scapula, I can still see right here, he's a little bit tipped out, so I want to be able to set him. So what I'm going to do is, with this, my manual contact doesn't matter. I'm not doing resistance, I'm just grabbing him. Okay, so I'm going to grab his shoulder girdle, and I'm just going to kind of get a sense of how much mobility he has in his shoulder and where his shoulder girdle's sitting. And when I just contact him, I feel that he's sitting a little bit protracted or abducted, which is a pretty common position. So all I'm going to do is just slightly elevate his scapula, and I'm going to bring him down so that his scapula is flush on his rib cage. Okay? You see where he is right there. So I've got my thenar eminence right at the lateral aspect of the inferior angle of his scapula. So I can get him from this position to slightly elevating him, bringing him back, and setting him here. So now his scapula is in a much better position. Okay, can you guys see that? Again, if they are going to start here, first thing I have to do is get him in a good position. I need to put his humerus in the line of the direction that I want him to go. And I don't need to bring him all the way up here. I'm just going to slightly elevate him to get him in a loose pack position so I can get him moving, bring him into that adducted position. I'm not bringing him all the way back and rolling him. I'm just slightly adducting his scapula on his rib cage, and I'm setting him right here. So now, when I go to work in that direction, his scapula is now in the plane of the scapula. I'm basically trying to get his scapula where it should be to start working. Now, I can get him moving wherever I want, but I'm not going to do it with his shoulder girdle there. Okay? So now, let's talk a little bit about the pattern of anterior elevation, or this goes for all the patterns. I showed you in standing just showing my shoulder elevating up. Okay? The pattern is not just straight up and down. The biggest thing that I think people struggle with is missing the rotation. And there's a big rotational component to all of this. And I'll use the analogy of a tire. Okay? If you were to think about a tire, okay, you're driving around in a car, you hit a wet patch, you jam on the brakes, what happens? The tire stops spinning and it just skids. Right? So if I were to show skidding with his scapula, so if here's his scapula, and I were to just skid it, it would be just moving up and down. That's a skid. Okay? Now, if I'm then on some wet pavement and I just gun the engine, and what happens? My tire just starts spinning before I even start moving. That's just rotating. Okay? When we're talking about how the scapula moves, and how the pelvis moves, and we'll get to that, but how the scapula moves with all of these patterns is it's a rolling. Okay, so we know when something rolls, it's not just skidding, it's not just spinning, it's actually rolling. Okay, so we're trying to get like a revolution as you're moving forward. So if I'm on his scapula and I'm just showing him the pattern of anterior elevation, it's not here. That's just skidding. Okay, and I'm going to move for you so you don't have to do anything. It's much more of a rolling coming forward and rolling coming back. So my hand is on his scapula, so it's just going forward and back. There's a big rotational component to that. Again, that's where people struggle the most, is not getting the rotation. We don't want to train people to elevate their scapula and just start shearing it up and down, especially when we get into posterior elevation, because people tend to already hold their scapula up here. So it's not training that, we're training the rotational component, which is how we get the arm moving with it. Does that make sense? All right, so what we're going to do here is I'm going to make sure he's positioned well. Again, I'm going to slightly elevate and adduct him so he's in a set position. And all I'm going to do now is just passively move him into anterior elevation so he can start to see what I'm doing. Okay? This technique, you'll see it on the forms there, it's called rhythmic initiation. Okay? That's starting to teach the movement. All right? So if I take you here and I'm just going to show you what anterior elevation is, I want you to just stay nice and relaxed. Let me move you, and I'm just going to bring you up and back down. And bring you up and down. And now you can see one of the tools that I talked about was traction. I can't just move him up and down. If I want to be able to get that rotation, I have to really pick him up, and I'm getting that rotation component so he can feel what anterior elevation is. So anterior elevation is that shoulder coming up. Again, it's going between his ear and his eye, but closer to his ear with that rotation of his scapula. Okay, so here's my rhythmic initiation. Just stay nice and relaxed. Let me move you. You're set in a good position. We're just coming up and back down. Coming up. And I'm just moving for you. Okay, now when we're doing rhythmic initiation, you can feel that this is a totally passive movement, and all I want you to do is start doing this with me. Okay, just start helping me. Good, a little bit more. I'm not doing any resistance. This is all, I went from passive to active assistive, really to active range of motion. Okay, so you can relax for a second. Now, if you watch me do that and just take him through that pattern, where do you think I'm working? What part of my body? My legs, absolutely. My arms aren't really doing much. Okay, your legs are the strongest part of your body. If you're going to do PNF all day, you need to have strong legs, and you need to be able to use your legs efficiently. So when I take him through this pattern, that's why I need to be in that direction that I want him to move. I need to bring him from here, and I'm bringing him up, and it's basically just a weight shift. So here's our rhythmic initiation. We're coming up and forward. And we're coming up and forward. I'm not doing any resistance. I just got him in a position, and I'm teaching him that movement. Okay? So that's rhythmic initiation into an anterior elevation position. All right? That's all I'm going to have you guys do at first. All right? So we're going to go into a lab. We're going to have you get with a partner. We'll work on getting them set up in a good position, setting their scapula, and just taking them through so they can feel that anterior elevation with the rolling idea.